Guys, welcome back to Medical Coding with Blue. Today's episode is all about reviewing the Optum 360 ICD-10-CM Expert for Physicians 2022 book. This is your coding manual, your diagnosis coding manual. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, we're going to take things back to school this week. All this week, it's going to be nothing but reviewing these books. And when do these codes apply? A lot of people are asking, how do we know when to pick up multiple codes? How do we know when to pick up a diagnosis code or a procedure code or a HCPCS code or an E&M level? A lot of these questions are being asked kind of prematurely. So there's an expression anytime, anywhere, that says you have to crawl before you walk. That's one of my most favorite expressions, crawl before you walk. Now, what does this mean? Crawl before you walk means that you have to know the basics. You have to know the steps in order to get into walking and in order to get into running. It's just like a child who is learning how to walk. They have to take their first steps and then they have to learn how to walk and run and everything. It's the same thing with learning medical coding. If you are brand new in school, you should not be asking the question, how do we know how many codes to pick up? Your first lesson is learning how to use the book and learning how to look up codes in the book, along with learning your coding guidelines, okay? This is typically why in most coding programs, the coding part is towards the end of the program because they're laying the foundation work with the medical terminology, and the anatomy, and the pathophysiology. All of these things are important. Medical law and ethics, all of that is important before you start getting here because those are your steps. Those are your building blocks. And it's the same thing when you get to this. So before you start asking all these questions, well, when, start learning how to look codes up in the book. Get familiar with your book. Now, I'm only referring to Optum this week, except for the AMA Professional Edition by for the CPT manual, because this is what I use. This is what I'm most comfortable with. Some people will want to use different publishers. You do have your choice of publisher when you are taking the AHIMA, the American Health Information Management Association, or the American Academy of Professional Coders, AAPC exams. You do have your choice of publisher when it comes to your diagnosis book. So this book is okay to use, this publisher is okay to use if you are sitting for one of these association exams. And if you don't believe me, you could check out the websites for either one because they do give a list of approved books. And when they say it's your choice of publisher, this is what they mean, that you can pick from whoever makes these books, okay? I just prefer Optum because this, by far, is the best of all of the books that I have ever seen when it comes to diagnosis ICD-10-CM books, okay? This is what I choose, and this is what I talk about on my channel, this is what I promote on my channel. I am not a paid sponsor, none of this, okay? So they're not sponsoring me, rather. So this is all genuine and true. I would never bring you guys anything that I would not pick for myself, okay? So that is first thing out of the way. Now, we're going to go ahead and go through this, but I want you guys to notice something. My book is not tabbed. My book is not tabbed, and I'm going to talk about tabbing here for a minute. Now, if you are a student and a bunch of people are telling you, oh, you have to tab, you have to use the dividers that come with the book, because if you are sitting, this is namely for my AHIMA folks, if you are sitting for an AHIMA exam, the CCS, the CCA, or the CCSP, they specifically word in that candidate hand guide that you're not allowed to have handmade tabs on the books. You can only have the tabs that actually came with the book. So Optum has dividers for their different sections. I don't use them, clearly. I never have. And I do not recommend tabbing your books. Now, my advice is my advice. And my advice is for those who are looking for direction. If you choose to have tabs with your book, that is on you. But if you are using tabs with your book, this is telling me that you need more practice, because you should be able, once you've been practicing with your book, to open up the book to wherever you need to, and you won't need those tabs because you will be practicing with it a lot. So that is what I would recommend on my channel. If you have an opposing opinion, that's fine. feel free to not leave it in the comments. All right, so here we go. This, we're going to go through this section by section. So they do. We're all about coding. They are really, truly about coding. So when you see this right here, it gives you the detailed instructions on how to use the book. All right. Now, this is the best I'm going to do with my camera because I use my phone to do for my camera filming purposes. So you're not going to see a lot of this writing in here anyway. But this is the first part. Then it has what's new for 2022. Every time there's an update, they're going to list all the things that are new. They're going to tell you about the deleted codes, and they're going to have them here. So if you are using this book, you're going to immediately know like a summary of like the updates of what's new, which is really great. And then they have the conversion table. So this is all of the old codes, and then the previously or the new codes rather, the new codes, and then the previous codes. So when it has updated, you'll know exactly what the code has updated to. All right. So it'll be like a general code, and then it'll update to like the updated code. So, which is also great because you can just look it up right away. Then you have your 10 steps to correct coding. And then we have our official coding guidelines. Now, all ICD-10-CM books have the copy of the coding guidelines in the book, all right? Because these are our rules. This is what we go by, all right? So because of this is very important. The writing is very small, so it comes out to like 30 some odd pages, 38. I don't know why I can never remember. But I think it's 38. No, 34. It's 34 pages altogether, all right? Now, I tell you guys, if you're a student, you need to be reading these coding guidelines once per week. Now, you don't have to read them all in one sitting, but you can break them up over 3 or 4 days. Just read, just a few pages at a time. And so it's just front and back. And the byproduct of reading the coding guidelines is that you get faster with reading. And that's very important no matter what exam that you're taking. It is very important to work on your reading speed because it's 2 minutes, 40 seconds per question. If you're taking an AAPC exam, like the CPC exam, it is roughly 2 minutes per question if you're taking the CCS, the CCA, or the CCSP. So it's all about quickness and quickness with reading. So just make sure that you're going over this, knowing your coding guidelines. And I'll tell you guys, it's not going to make sense when you're first reading it. It probably won't make sense the majority of the time that you're reading it, because there's a lot of technical stuff that you will learn along the way. But imagine that you have been reading your coding guidelines once per week. So when you get into the coding part, you're going to be so proficient with these. The key is not to memorize, because people start hyperventilating when I tell them don't memorize, because you don't need to. It's too much psychological burden on your mind to be forced to memorize things that you don't need to be memorizing. These coding guidelines do get updated every year. Sometimes it's a subtle change, sometimes it's a major change, but they do update. So the idea is to develop an understanding. And how do you do that? You do that simply by reading, rinse, and repeat. So that's what you're going to do with this section. And anytime you have a question, you can always flip to your guidelines. You can use the entire book when you're taking the exam. So that's why it's very important that if you can't recall a guideline, that you know exactly where to flip to it. And if you've been reading it sufficiently and many times, you're not going to have this issue. All right. So here is the index. Now, all of the index, and I'm not going to go into like a breakdown of the index or anything, because I think that's a little elementary. You guys can figure this stuff, and it's going to be easier once you start practicing with it. But these are where all your diagnoses are at. You are always going to need a diagnosis for the claim. It does not matter if they're doing just an E&M, if they're doing a procedure, if they're putting out HCPCS codes. You are always going to need a diagnosis. And this is the one that you will always need. You won't always need an evaluation and management code. You won't always have a procedure code, and you won't always have a HCPCS code. And so in turn, you won't always need a modifier either. Modifiers don't go on diagnosis codes, okay? It's a diagnosis code. Those are meant for the highest specificity. What did the patient come in with? So that's where you're always going to have to reference this book, okay? You're always going to have a diagnosis code no matter what. And it's going to be the most specific diagnosis code possible, all right? So with that in mind, here's all of your, your very large index, okay? So it starts off with the index, and then we have our neoplasm table, okay? So anytime you are working with neoplasm patients or you have a neoplasm diagnosis, it's going to be in here, okay? All your cancer diagnoses are all here. And then we have, so that's a neoplasm table. And then we have our chemicals table. There's certain words that I cannot say, so I'm not going to say it. But it's our chemicals table. So these are all those ones, okay? So there's going to be there. And so if you have a diagnosis specific to that, then that's where you look, okay? Accidental poisonings, intentional poisonings, that kind of thing. So that's where this is at, and that's what that is referring to. And then we have our external cause codes. As somebody who codes for ortho, I love this section. So there's external cause codes for everything under the sun and then some. You have your external cause codes that some are 7 characters, right? And they'll end with an A, a D, or an S, right? Initial, subsequent, and sequela, depending on the encounter instance, right? If it's the initial, or if it is subsequent, or if it is a manifestation of the injury and it's a sequela. So this is where it's going to be. You will also find activity codes, place of occurrence codes, and those are very short. Those are a little shorter, and you're not going to need those past the first time that you report them. So you may get where you have to report an initial injury code with the initial external cause code. But if that patient's already been seen and they're being seen someplace else and they're still in active treatment, you will not have to pick up for a second time the activity code, place of occurrence code, and like their work, whatever they were doing, their occupation status or whatever. You won't have to do that. And you'll get into that in your course. This is, again, just a overview of the book and how helpful this is. But yeah, you will find all of that here. Okay. And then we get into our chapter 1, right? So certain infections and parasitic diseases. What I love about Optum 360 is that they always have this. They have examples, and then they have the explanation. So they have the like a scenario, and then they have the codes that go with it, and then they have the explanation. Optum is the only one that I see who does this. So that's why I really love this book. And it just breaks down everything that you need to know so that you do have examples of how certain diagnosis codes go. So it goes through every single one of these chapters. And as we flip through here, we can see that they do have like definitions. And then they have for codes, like they have like those notes about it so that can kind of give you some guidance. And it's just, and then it talks about it talks about code first. So it's giving you like a sequence. Like if you were looking this up, it's giving you a sequence. It's telling you to code first the underlying disease such as, and then it gives you all of the diseases that would go first. And then that would be your secondary code. Okay. So that's how you start learning from this book. It's going to take some time. Yes. But that's what I love about Optum is that they have all of these definitions. They have these little helpful notes all throughout the book. And it just makes it so much better when you're looking stuff up in the book. Now, sometimes people will ask me about like how it is with the encoder. I do have the encoder demonstration video from 3M. But you're not going to be able to use the encoder when you're taking an exam. You have to use these books. This is why I am telling you guys all the time. You have to learn how to use a book. And in order to learn them, you have to spend time with them. If your instructor is not showing you, not breaking it down, then you need to get in there and you need to try to learn on your own. Now, if you need help, there are a ton of tutors on LinkedIn. I'm a tutor myself. My rate is in the description box below. So that's an option if you need it. But medical coding is very much independently learned, and they may have promised you something else when you signed up for the school, but that doesn't always happen. Unfortunately, people will learn that. And as many times as I try to tell people, sometimes they just don't find my videos in time. So, but here's like your appendixes. Your appendixes are so important because they give you lots of really good information. And this is Appendix A, valid 3-character ICD-10-CM codes. So in case you only see that it's 3 characters and you're like, is this code complete? This list back here will tell you, okay? Then you have this other Appendix B, again, another word I can't really say. And so, not because I can't pronounce it. And then you have Appendix C for your long-term use codes, right? That's all of like the brand names, okay, which is very helpful, okay? Sometimes we don't always know what type of a thing something is. So that's very helpful for that. This is Appendix D, Z codes only listed as principal or first listed diagnoses. Okay, very helpful. And then we have Appendix E for HCC, the hierarchical condition category coding. If you're a risk adjustment coder, this really applies to you. So to better understand it, here's an explanation. Okay, and then Medicare and Medicaid Services Quality Payment Program, right? And then we have our illustrations. So a lot of times people will freak out about the anatomy. Blue, I don't know anatomy and I haven't studied it and I don't understand it. A lot of this stuff is already in the book, guys. So if there's something that you need to look up, look at these tables and you'll see where everything is here and how it's all broken down, okay? We've got beautiful illustrations. I mean, it's got like the brain and all those things. So it's got all of these things. This is a wonderful, wonderful book. Okay. So it's got all of this. So this is literally the rest of the book is all of these anatomy things. So I want you guys to study your book. It's less overwhelming when we educate ourselves, right? Because what causes like nervousness and anxiety is the unknown, right? If you spend time with this, even if it's just an hour at a time, because I tell you guys, don't study for more than an hour at a time. If you study an hour at a time, it's going to get easier. Take a break, get water, hug your kids, hug your spouse, come back to, your studies, study for another 30 minutes. There's time. You can make time, all right? Your future is waiting. Your future in medical coding is waiting, but you have to be proactive about it and learning your coding books, learning what they're about, and learning and asking the right questions at the right time is the right thing to do, okay? If you are coming out with all of these questions or you're thinking of them like, how do I know how many codes to pick up and you haven't started learning how to code yet? Write them down so that way when it is time for you to have this question, you can look at these questions and be like, oh yeah, now I know when to use multiple codes. Now I know when to apply a diagnosis code or a procedure code or an E&M code or a HCPCS code. I know when to do that. So writing stuff down, these questions will help to kind of relieve some of that worry and relieve some of that nervousness because it has a place to go. These questions have a place to go instead of swimming around in your own head, making you even more nervous. That's just my advice anyway. Keep your books clean. There is nothing that you need to write in this book that hasn't already been written. That if you've been practicing with it, if you've been studying it, if you've been looking at it, then you're going to know what I mean. You writing anything in it is only going to clutter it up, is going to bleed through the papers. Somebody asked me, oh, well, what pen do you use so that it doesn't bleed through to the rest of the... I don't use anything. This book stays clean. All of my books have always stayed clean, and yours can stay clean too. You write your notes in a notebook that you can use as a supplement with this. And before you tell me, well, that's just how I learn. Guys, you can take the time to learn this way too as well. Some people just want to use those notes as a crutch and, oh yeah, that's going to help me to pass the test. No, it isn't. because I guarantee you that's probably not even going to be on your test. And all that time you wasted writing stuff in your book. Don't write anything. Don't highlight. Just use it. Practice with it. Get to know it. Look at it. Flip it open and turn the pages. It's worth it. So I'm going to end my episode right there. But I will be back tomorrow for another book review. So that way you can kind of go with me on this back to the basics. So I will end this episode right now. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I will see you guys next time. Bye.